Well, let's bring in New York Democratic Congressman Anthony Weiner. Representative Weiner, always great to have you here. And let me just sort of preface this conversation I'm going to have with you with a shout out that of all the people, whether people agree with you or not, of all the people who have spoken about health care reform, you're the only person who has consistently made things understandable. The only person.
Well, perhaps in the land of the blind, the one-eyed man is king. This has been a little bit of a complicated debate. Thanks.
So let's talk about tonight. You just heard Melody talk about what the president needs to do. What I've heard you articulate is still different than anything I've heard the president stick his neck out for. What do you want to hear tonight?
Well, first, I think he has to make it very clear that just left to their own devices, health insurance companies will exclude people they don't want to cover, will continue to raise prices at a dramatic level, and frankly can't be trusted just to outsource the responsibility for providing health care. They're not doing a good enough job. And he needs to make it very clear that we need consumers to have some choice. And whether it's the public plan or something else that he's going to talk about, we have to have some kind of a choice which drives down costs for everyone. So I guess the bottom line, he has to be pretty vigorous in his defense of his original notion, which was the public plan, a public choice that people would have the option of opting into if their employers either don't provide health care or provide health care that they don't like.
One of the things that I think has been so confusing for people is that there is just no plan. There have been a lot of ideas floating around, and I want to focus on right now what Senator Baucus's plan is shaping up to be, that it may be $700 billion over the next 10 years, that there will be insurance co-ops instead of perhaps a public option, a new tax on insurers with the most expensive plans, those that have sort of the deluxe plans, no public option per se, Medicaid, tax credits to help those who really can't afford anything. Does the Baucus plan have any meat in it for you?
Well, it has some good elements to it, but it fails on a very fundamental level, and that is guaranteeing that consumers will have choice and having any mechanism that brings down cost. We just don't see that in any of the plans. Look, there's a reason that Medicare has a 4% overhead rate, and private insurance companies have as much as 30% they take away in terms of profits and administration. And the reason is that, frankly, this government program, Medicare, which is our version of the public plan from 44 years ago, really does help contain costs. Now, it has its financing problems as well. The other problem with the Baucus plan, this notion of a co-op with doctors join together and try to negotiate for lower prices and try to hold down costs, we have absolutely zero evidence that it's going to work and zero evidence that it ever has worked. We need only thing that is as muscular as the insurance lobby right now are those of the taxpayers, the federal government. That's the only way you provide any competition. That's the philosophy.
To push back a little bit, we have had representatives from the insurance company on this program, from the insurance industry, who said, look, we've come to the table. We will stop pre-existing conditions. We will allow portability. We'll look at ratcheting down healthcare premiums. And yet I've heard you say to people, tell me one value that your health insurance company brings, and I must tell you that's what stumped me.
Well, that's the problem. Insurance companies, if it's car insurance, then they're apportioning risk among all consumers. Not in this case. They're not covering anyone over 65. They charge exorbitant amounts to any individual who tries to enter the marketplace, and they dump people who have what they call pre-existing conditions, which is their catch-all phrase for rationing care. Look, I don't vilify the insurance companies. They're doing what they're supposed to do. Take in as much money, give out as little as they can. That's their business model. Our business model as the government should be entirely different.
Can you get something without the public option through the House?
I think it'd be very difficult not only to get something through the House, but also how you define it as anything different than a retreat from the basic philosophy that we need competition to drive down costs. I think the president tonight is going to stand and do what only a president can do, and that is to say, here's why we need it, and here's what I'm going to prepare to do to fight to make it happen. I like Senator Baucus. He seems like a decent man. He's not the president of the United States. Barack Obama is the person that campaigned on the idea of having competition. That's what we need.
So if you have a choice between LBJ and Gandhi, who do you want to show up tonight?
I want the president that's in there. David Axelrod said, I think it was even on your show, that we're in the 9th inning of this. That's not true. Our cleanup batter hasn't even come to bat. That's Barack Obama, and I'm counting on him to hit it out of the park tonight.
Representative Weiner, always a pleasure. Thanks for taking the time today.
Thank you.
You bet. Look forward to hearing what you have to say after the president speaks tonight. You can catch the president's speech right here on MSNBC. Our special live coverage begins at 8 p.m. with Keith Olbermann, and that will be followed by a special edition of Countdown and then Rachel Maddow. And for more on this debate, the health care debate, all the things we talk about, including videos and interactive features and a glossary of health care debate terms, all you have to do is log on to healthcare.msnbc.com. And now we're going to switch from health care debate for a second and find out what else is happening in the news. And for that and the headlines, we're going to turn it over to Alex Witt, who is at the news desk. Hi, Alex.
Hello to you, Dr. Nancy, and hello, everyone. Well, police say that the bone fragment found in Philip Garrido's backyard is probably human, but more tests need to be done to determine who it belongs to. Garrido is accused of kidnapping and holding J.C.